So I think there have been a lot of really positive outcomes from ACE's advocacy work. I mentioned earlier that medication listing. So that's certainly not all that we do, but it's one of those really hard targets that's easy to measure. So in one province, one medicine isn't listed, and then you come in and you do some education work with government. You actually help people understand what is and isn't available to them. And then at the end, you either are going to see a listing or you're not going to see a listing. So it's one of those, again, a very hard target to measure. And I think we've been, I think we've been very successful in not only helping government understand how important medications are in the area of arthritis, because there is no cure. We don't know biologically what to do to stop or to shut the disease down. So medications are an underpinning of a treatment plan. I think another area that we've really excelled at is in bringing the public with arthritis' voice to the public media, to television, radio, newspaper. ACE members across the country have gone to our website, they phoned us, they emailed us and said, geez, I really got turned on by something that was on your website. Tell me more about that. We give them the information, and then they turn around and say, hey, I can go talk to my local media. I can write a letter to the editor. I can actually put my voice with their larger voice and the voice of the membership across the country to affect positive change. And we've seen that every day since we founded in 2000, and it's just fantastic to see someone with arthritis who was depressed because of their diagnosis, was disadvantaged because of an inequity of care, was not well understood because of the lack of information that was available to them and to their family and friends and their employers, and to see them flip over like a coin and just become a new person because they were empowered to go out and do something for themselves, and by default they're doing something for 4.5 million other people in the country. So I think that's a really shining result. We obviously actively work with media on a daily basis. We're a stopping point for them when they're gathering information or they want an authentic voice of arthritis in their piece, whether it again be radio, television, or newsprint. And they know that we know our stuff, that we work very well with the research community, and I think that that they're coming to us is a real sign that they view us as a credible source for information. We have had a number of educational meetings with government over the years, and we know from feedback that we receive from government that they are better informed about what kinds of decisions they should entertain to develop better policies for people living with disease. We've shown them how involving people with the disease actually improves the decision-making process. All of those things we at ACE view as a very positive outcome in terms of our advocacy work. And I think lastly, if we elect people into office, those people are ultimately our champions. And I think that ACE has done a really good job, as have other arthritis organizations working on behalf of people with arthritis in the country. We've done a really good job creating champions, both at the provincial government and federal government level. So we're really pleased to be able to look across the country and province to province say, oh yeah, that MLA, that person has really been a true champion for our community. And these are people who really didn't know much about arthritis before we interacted with them. So again, we are just a conduit for the information, for the notion that you could do more for people living with arthritis, and then to be able to support them in doing that. So I think that those champions out there, we want everybody to be a champion for arthritis, needless to say, but you get them one by one, and I think that's what we've done over the years. Well, if you want to get involved with advocacy with ACE, there are a number of different ways, and sort of the intake valve, if you will, is jointhealth.org. It's our website, and the website has all of the advocacy goodies, if you will, that will help get you informed, first of all, and get you thinking about what areas of advocacy you might want to become involved in. So first you have to arm yourself with information. Your argument is only as good as the facts that back it up, and I think that's one thing that has distinguished ACE from maybe other groups working in other disease areas. We have worked very closely with other consumer groups in arthritis, and so we're constantly sharing information. So if you go to jointhealth.org, you'll find our partners in the community there. We encourage you to join up with them so that the broader you make your base, your information base, I think the more powerful it will be for you if you're looking to do some advocacy work, either on a volunteer or a paid basis. So educating yourself is really important. And as part of that process, obviously at jointhealth.org, anything that's breaking is going to be on our site. So if something happens in the way of a policy change and you think that either negatively or positively affects you, you can go there and find the information and then take action yourself or within your community if in fact you're in a leadership position in your community. I think ultimately, at the individual level, you can write. You can pick up the phone, find out who your MLA is, find out who your or MPP, find out who your MP is, and make certain that they know you exist and that you're existing out there as a person with arthritis, as well as the many other aspects of your life that make you a whole person. But let them know that you face a significant health challenge, and that health challenge called arthritis is vastly misunderstood, that it doesn't have the kind of funding, not by a long shot, that other diseases have that are as serious as arthritis. That arthritis kills. It kills just like cancer does. It kills just like HIV does. People don't know that, and particularly government officials don't know that, and they need to if they're going to make smart policy to care for a disease that is one of the largest burdens on the Canadian healthcare system. So join jointhealth.org, look at our programs, offer us suggestions. We're only as good as the input we're getting from our membership and from the public, so we really encourage you to tell us your big, bright idea, and we'll try to act on it if it's within the realm of possibility for us. So I just encourage everyone to join up and join other arthritis groups as well.